Hi, welcome to Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley. I'm very pleased to introduce today's guest, Dory Haddock, the CEO of Natural State Recovery Centers in North Little Rock, Arkansas. Welcome to Addiction Recovery Place podcast, Dory. It's great to have you with us today.
Thanks for having me.
No, I really appreciate you spending your quality time to come and talk to me today about the wonderful work that you're doing in your state. But we'll just get started with the first question. But can you tell me about yourself and your journey to becoming the CEO?
Sure. I'll try to give you the condensed version of it. I grew up in Albuquerque, New Mexico, and this is important because I went on to play softball at a small junior college right out of high school. And just always kind of, when I was there, I was diagnosed with diabetes at the age of 19 and kind of started deciding that, there's a lot of people that helped me along my journey of a life-changing illness, and became real interested in the field of social work. And that's kind of how I started going down that path. And so I got my undergraduate in social work and my master's degree in social work. And it really came from a long line of healthcare professionals being social workers that helped me navigate being 12 hours away from home, playing softball with this new insulin-dependent diabetes at the age of 18. So it was definitely a journey that is kind of, while I was there, trying to figure out what my path is going to look like. So I went to school, got my degree in social work with the intention of going into medical social work to help others. And along the way, started working with young children, 6 and under, doing some therapy with those kids. And the common denominator between everything I've ever done, whether it was kids 6 and under or working in therapeutic foster care as a therapist or a clinical director, the common theme was substance use disorder in those homes. And so I really kind of accidented upon it about 20 years ago, and started working in the field of substance use. At the time, it was addiction treatment. We're trying to change some of the language that we use to prevent stigma. And so I started a company. I worked for a company named Bradford Health for 14 years and started the first intensive outpatient here in Arkansas for that company 14 years ago. So I was with them started our first outpatient there till we went to added intensive outpatient, moved on to add a partial hospitalization. And then we eventually collaborated with a local hospital and had a partnership with them where we opened a detox residential IOP, PHP, and outpatient, all within inside that acute care hospital. It was a challenge and exciting, but around that same time, we at Bradford decided to go a different direction, and through some conversations with where we were headed in the state of Arkansas, we pulled out of that facility. And at that time, I was already in communication with Natural State Recovery Centers, which is local, and they kind of saw my vision for where we could go because it was theirs, but they needed somebody to take the helm as they had been, their last CEO had been gone for a couple of years. And so they brought me on board to come in and take it to, as we said, we're taking their baby from high school to college. And so that's what happened. And I've been with Natural State for right at 4 months now.
Yeah. Wow. Congratulations. That seems a pretty extensive journey you've been on. And, the fact that you're able to, work at a local recovery centre to where you're living, that's pretty cool. So, well, congratulations about that. I've been looking at your website, and you do some pretty extensive work with your clients. So, can you tell us about the 3 levels of care that you provide?
Sure. So it starts with inpatient. In our facility in North Little Rock, we have detox. So we do a 3 to 5 day medical detox. We have 24-hour nursing care, where they step down to our residential, where they can typically stay between 20 to 30 days there. In residential, they get at least 3 hours of group a day by a licensed master's clinician. We do the multidisciplinary team approach there, where we also have peer support recovery specialists coming in. We have yoga 3 times a week. They do exercise the other 2 days a week. We just recently bought 2 dwarf goats. And so now we have little goats yapping and yelling at us. And that's been a real exciting thing for the patients to go look at. We're not doing like pet therapy or yoga or anything. It's just having them on campus has been kind of a fun thing. We have nursing, like I said, nursing care, peer support, counselors in training. We have all of our mental health techs, say about 85% of our employees are in recovery themselves. And so after residential, they step to our outpatient location, which is actually in Little Rock, Arkansas, where we have partnered with 2 sober living homes as well as one that we own. And we offer partial hospitalization, intensive outpatient, and then we've just started an outpatient to provide individual group medication-assisted treatment for after the patients have gone through our continuum of care. So piecing it together with just detox residential and outpatient, we can get 90 days of treatment for the patient, but then we're allowed to follow them indefinitely in the outpatient clinic part. As well as, like I said, we've partnered with a couple sober livings. We own a sober living ourselves. And so a lot of the patients that are in partial hospitalization IOP are actually residing in one of those recovery housing.
So it sounds like you've got a very extensive level of care. So you do a lot of aftercare as well. So someone leaves your service and they still get indefinite care.
Yes.
As well.
Yes.
Wow.
So they've made those connections and they can stay in there and we know that patient, and it's real helpful if they're having a return to use or having any issues, then we're already have our eyes on them and we can help get them the help they need.
Yeah, most definitely. Do you work with family members as well?
We do. At this time, we don't have a family program, but it is something we are in the process of 2025 to develop and create. Nobody really is doing anything with families in our state, and it's such a key component to it. And when I say doing anything with them, I mean real intensive, like an actual program that's geared towards that family to walk alongside that recovery journey with their loved one.
Yes, most definitely, most definitely. So we've been in the post for 3 to 4 months now, Dory. What have been some of the challenges that you've encountered just in this very short space of time that you've been in post?
So obviously, commercial insurance is always a challenge for us. We are a for-profit organization, and we take all of your major carrier commercial insurances, and so we do struggle with the reimbursement rates that are in Arkansas are about 60% less than they are across other states. With some higher expectations and regulations of what need to be acquired. So that's always a challenge. That's been a challenge since I've been in this field, working through some of that, trying to get to the key decision makers in your Blue Cross Blue Shields, your Ambetters, your Cignas, to try to get them to understand, to provide what we really need to. We need a little bit more money. I think for natural state recovery specifically, what I inherited was only could access calls or admissions Monday through Friday from 8 to 5. And as we know, substance abuse is not a Monday through Friday activity. So I've actually changed that already. We're now answering phones 24/7. We have changed the admissions process to 7 days a week. So that was a big part of it. We also increased our programming. I kind of noticed as a clinician, I look at running this organization from a clinical perspective and mindset. We had a lot of downtime for the patients. And so we changed that by adding different groups to different activities to make sure that they were engaged all day long and doing something so that they were not letting the mind wander in those early stages of recovery. So the challenges have been access to care, I think, for our patients, really. It's just the phone calls. You go online and fill out a website application that's 7 pages long. We can do a 7-page application on a website. So we have a new website, completely different website. We've revamped it. The branding, the marketing, the recognition of what Natural State really is and what a really cool company it is, because we're local, we're here, we're centrally located in Arkansas. And I want to highlight that in our websites and marketing and outreach and all that we're doing. So the main things have been access to care, getting the patients admitted 24/7, community knowledge about what we do across the state, not just in Little Rock. I think that's a good start.
Yeah, that's an exception.
for 4 months.
That's amazing. I mean, so since you started, you've completely changed your referral program. So someone could just phone up 24/7 and speak to a member of your team. So have you seen a bigger uptake in people accessing your services in the short space you've been there?
Yes, we've actually doubled our admissions, and we have decreased our AMA rate by about 23%.
Congratulations.
In a short period of time. And wow. I attribute that to many different things. And the main thing that I inherited that's the most important is my team. They have been an incredible team that I got when I came on board, that really do care about our patients, and their willingness to just get behind me and support the decisions that I'm making to make all these changes in a very brief period of time. Is general people don't like change. So I'm trying very hard to be slow and steady about it, but anybody that has met me for more than 5 minutes knows that's not not really my jam.
Yeah, so. I could tell. I could definitely tell. So can you tell us about some of your staff members? Because you said that they've been very supportive of you, and as a new CEO, that must be very reassuring for yourself as well. So can you tell us about some of your team members?
Yeah, sure. So I have our director of quality assurance. Her name is Nicole. She is really the all things. She does everything over there, and she's really herself and JD have been holding the fort down for the past 2 years. And Nicole does not like the spotlight. She'll probably be very mad at me for even mentioning her name on this podcast, but we would not be where we are without her. She is, she actually lives on site. So she's there throughout the week. She goes home to her home. It's about an hour away from here on the weekends, but so she's always working. She's making sure that we're staying on top of things from a quality assurance perspective, that we're getting our insurance documentation done. And she's just great. And then JD, who is serving as kind of the interim director between the last CEO and myself, he's really responsible for all of our growth and looking at opportunities. He's our director of strategic initiatives, but he's also over our facilities management, our culinary staff, and our transportation staff. So, those two have really they've been keeping this afloat for the past 2 years. And as we joke, JD started with Natural State Recovery Centers from the day that it opened back in, I think it was 2014. And he also lives on campus as he was responsible for getting this old school, redone and retrofitted to be a treatment center. And he's phenomenal. He's got a lot of energy and a lot of just positive vibes, I guess is the best way to say it. And he's the one that I was joking with saying, well, I'm taking your baby and we're going to take her to college. Cause it's very difficult when you put your heart and soul into a company and somebody new comes in and says, hey, I think we should do A, B, C, and D. And JD's been really good about being able to acknowledge that these are all really positive things. And he'll tell me all the time, I've been trying to do that for 2 years. So I think we're really well-aligned team. The three of us work really well together. Like I said, most of our staff is 85% of them, I think, are in recovery, long-term recovery themselves. And so to point out one person that's doing just great work would be really challenging. And that's a good problem to have. But we have some great psychiatric nurse practitioners we have them 5 days a week, 8 hours a day at both our outpatient and our inpatient. Our medical director is a dually board certified addictionologist as well as a psychiatrist. All of our techs, the ones that do the day in and day out, they're the ones that are with the patients all day. They just come from a place of care and compassion, and that's you can't teach that. And so to me, it's so great. I mean, as an example, we had a patient come in the other day that was so impaired they could barely walk, and I've worked at facilities before that it was like, well, we can't help them, send them to the ER, or let's wait till they sober up a little bit. And I look outside, and 3 of my staff members are sitting on the curb out front while he's smoking a cigarette, telling him how glad that they are that he was there. And I mean, I just kind of got all warm and fuzzy because, like I said, you can't teach that kind of thing to somebody. You either get what we're doing or you don't. So,
wow, it sounds like you got the A team.
I think so.
Yeah. It really does, and it must be such a weight off their shoulders knowing that they've got genuinely good leadership as well, where you're going to take your service in the right direction. That's great to hear. It really is. So. You've been there for 4 months. What are your future plans for Naturals? The next 12 months, next 2 years. What do you see coming?
I'm kind of the mindset I go big or go home. And Arkansas is really again, I think this goes back to my softball days. I was a pitcher and I was like, go, go, go all the time. And has not left my body, even though I've quit playing a long, long time ago. We are centrally located in the state of Arkansas. We are definitely lacking a ton of resources in our state. We're a little bit behind the times as well as what traditional treatment looks like. So my goal is we have in North Little Rock, we have a 54-bed facility. So we have the capability of 54 patients for our residential. My idea is to get us full. We have a lot of room for growth. We have a lot of buildings that are not being used. So hopefully we can continue to expand the amount of patients that we can have for our centrally located location. And then I would like to see additional PHP and IOPs in the 4 corners of our state. And then at some point would love to even figure out a way to reach our rural communities, even if that's through telehealth, where we have them in a spot and they're zooming into what we're doing at some of our physical locations. I don't want to give too much of my secrets away, but it's so to me, it's just really how do we provide access to care and quality care for the Arkansans, and honestly be a treatment center that people in other states want to look to and say, hey, this is where you go. This is where you go to get good quality care. So that's kind of my big goal. I have a couple other areas of Offsprings that I would like to specialize in. Family is one of them. I think it's huge. So that's just a little bit of what I have planned.
It's going to be a busy 2025 for you, that's for sure.
Yeah. I think everybody's kind of tired of me saying, well, just wait till 2025. Because I've came in August and there's only, so I'm really providing some structures, providing some organizational hierarchy, providing some systems in place. Kind of an example, we didn't have any way to track incoming calls or have I think it's a CRM. I always call it the wrong thing. We have that now. We've changed our website. We have a new admissions process. We're tracking our data now, which is going to help drive outcomes for us, but also track the outcomes. Then also let us know. That helps me come back to the Blue Crosses of the world and better and say, hey, look what we're doing. These are our outcomes, performance-based metrics, that kind of stuff. So that's kind of the goal of, I keep saying it, 2025, we're going to start this because we're going to just kind of put 24 to sleep and move forward from here.
Yeah. Wow. That sounds amazing. It really does. So congratulations on everything you've achieved so far. It's just wonderful to hear. You mentioned Arkansas is a little bit difficult sometimes maybe to work in the state around for addiction services. So how is your state dealing with the opioid crisis that's just wreaking havoc across the nation?
I would actually say that's probably the one area that Arkansas has done really well in. We have, when I started, we have one of the top peer support specialist programs in the country. Honestly, it's put together by Jimmy McGill and our director at the time was Kirk Lane, our drug director, and they really got behind what we need for Arkansas. They are no longer in those roles now. In fact, Kirk Lane is now over the Arkansas Opioid Partnership. And so what they've done is they've gotten some of those settlement dollars and they're dispersing it across our company or across our state with all falling with that opiate nexus of like, how do we prevent overdose? How do we prevent death? And so there's several million I think it might be a couple $100 million out there in Arkansas for opiate between our attorney general settlement dollars and our Arkansas Opioid Partnership agreement as well. So the peer support model is a 3-tiered model out here. So as you get your peer in training, and then you have to do so many hours and so much evidence-based curriculum to get to your peer support specialist, to get to your supervisor, to be a trainer. So it is a 3-tiered program, which is, like how all of us clinicians have to do. We have to get our master's and then we have to get supervision and then we have to get licensed. And so I feel like it models a little bit about that, even though they're not clinical. So having that peer support coupling with our treatment centers is huge. When I started the program at St. Vincent Hospital, we were the first treatment center in the state to employ peer support specialists on our own dollar and not through grant money. And we incorporated them as part of our multidisciplinary team. And I think the results were outstanding. We had buy-in from our therapists. We had buy-in from the nursing staff. The peer support mod into the clinical side of it. I think you can't live in a silo. Your peer support has to support your clinicians. Your clinicians have to support your peer support. And so I think Arkansas has done a really good job of that in embracing our peer supports and putting them in all kinds of different aspects and components. So that part's there. We have Nalaxone boxes, or they're called a Nalaxone, in all of the colleges. And I believe they're in most of the high schools across the state. So they have literally a place that you can go and get Nalaxone if something were to happen.
Okay. Yep.
So I think there's been a lot of information out there and lots of billboards that are like, don't run, don't flee. You're not going to get arrested if you drop somebody off that has an overdose. And so a lot of education on that.
Wow, that seems pretty progressive.
It is. I was very impressed with our state, to be honest.
Wow.
We have a lot of other state leaders coming in and looking at what we're doing with our peer recovery model and all of that.
Mm-hmm. Wow, I didn't expect that answer. So congratulations to your state and your governor's clearly doing a good job, which is great. Would you still? I just want to ask your opinion about something, Dory, because in today's world, it's quite disheartening that stigma around addiction and mental health can still discourage someone from wanting to enter treatment. Why do you think this continues to be the case, especially with everything that our country is now facing with the opioid crisis?
My theory on that, and I do want to clarify something real quick. A lot of the movement that we've had with our opioid epidemic has really come from our drug director and the director of peer support services. We've been supported by Asa Hutchinson and by Governor Sanders, but this has been a long going effort for them. And so I'll make sure that, Kirk Lane, Jimmy McGill, and that crew get credit for what they've done, because it's been very instrumental in where we're at. In fact, they started changing the slogans to stop the stigma. And so a lot of what we've gone around and have done is stop the stigma, stop using these words. We're redoing our website right now, and instead of addiction treatment, we're putting substance use disorder treatment. I mean, it's just little things of changing that name and those concepts. I think for a long time, the world was brought up in that drunk or the addict was the poor guy that's walking down the street that is disheveled and doesn't look good. That's your town drunk, right? It used to be. And I hate these words. Or the addict was that one that was on heroin. Well, guess what? Like, the opioid epidemic gets heroin too. And so I think it's just this social stigma for a long time of people, those aren't our people. I mean, I can't tell you how many times when I've gone to talk about doing new things that people go, yeah, we don't want those people in our lobby. We don't want those people in our building. And it's like, those people are here already and probably working for you, and you don't know it. And so I think it's just not only fear, right? You're fearful of somebody that's in active addiction or active use is already scared enough to stop. And if that one person says something like, oh, you're an addict or you're a drug, and it's just like, oh, well, I don't want to be that person, so I'm going to try to do it on my own. And God forbid anybody pay attention to the science behind addiction, which is what we all need to be educated on, and why this really is a disease. I'm not sure if I answered the question.
No, you've answered that. You've answered that perfectly, Dory, because it does seem that things are moving progressively forward towards a more softer tone around addiction, which is lovely to hear. Still got a long way to go yet, obviously, but things are moving in the right direction, which is good to hear. So thank you for that.
The other thing, one of the other slogans that we're seeing in our peer community is recover out loud. And so lots of shirts that say recover out loud, lots of t-shirts, because so traditionally your traditional 12-step programs are about anonymity. And that's great. But we've got a lot of people now that are like, I want my story out there because it might help somebody else. And so I do think that there's some shift in that as well.
Yeah, that's pretty powerful. Recover out loud. I like that. That's great. We're just going to speak about your career and what you've done in the past, Roy, because you spoke at the NADAC conference last year. How were you invited, and what was it? What was your presentation about? I'd love to tell our audience.
So we have a local NADAC representative here in Arkansas that was doing our boards. It was certifying our peer support. So we're doing some of that, and the person that was over that here in Arkansas was like, "Hey, it'd be great if we talked about, or we did what information how I incorporated peer into a clinical setting." And so our presentation was on incorporating peer support in a clinical setting. I mean, that's pretty simple. As how do we do it? How do we get the buy-in from the therapy side? Because it was still fairly new. So it was mainly about bringing a peer model that's traditionally just go out and help that person, to how do we incorporate them in treatment and still maintain the rules of a peer and the ethical guidelines of a peer, because they do have very different roles and can do things that a therapist cannot, as far as long-term relationships with that peer and helping that peer. So that's what the presentation was about. They requested us to submit a proposal. We submitted the proposal and we got accepted.
Well, congratulations on that. That's great, because you're obviously a NADAC member. So if someone was, what would you say to someone if they're considering going into this field of work and they were considering becoming an ADAP member? Would you say it's a good idea? Would you say it's a good option to?
Yeah, I think there's a lot of resources that NADAC can offer. Anytime it offers some credit. There's so much information out there about addiction. And if you just start Googling things or you start looking at it, you're going to get any answer to support it. But I think with facility or organizations like NADAC and your local chapters that are like here is the Arkansas Alcohol and Drug Abuse Council, working together, we're going to get a little bit more information about Top Notch. You have access to a lot of conferences and trainings online, in person. They help with credentialing. So I think it just adds a little bit of professionalism and some, credibility to what you and your organization are doing if they're getting in line with it.
Yep. It's a fantastic organization. I've been learning a lot about it since I've been doing these podcasts. It's lovely to hear, and everyone speaks very highly about it. So that's great to hear. Last couple of questions, Dory. I ask all of my guests these questions because I get some really interesting varied answers. But can you tell me your opinion of harm reduction, how it can play a role in recovery?
That's a tricky one. Gosh. So I can tell you, I started in the mindset of, if our clients, patients could manage their use in the first place, then they wouldn't be in our treatment centers. That was kind of what my mindset used to be beforehand. It's very much like, well, if you could manage how much you're drinking, or you could stop just using, which in my mind, that's what harm reduction was. Until I've done some more research, and I went to a conference not long ago where harm reduction is like, how do we get our patients into the right frame of mind to be able to benefit from treatment or whatever that long-term recovery looks like? And so what I mean by that is we had a speaker that came out to a conference I was in Florida for, and he talked about how he was running a program with unsheltered individuals that they let them move into their housing while still using. And the result was that once they had those basic needs met, right, air, water, safety, food, that then they were like, hey, I want to stop using. I want to start doing this. And so this program really was geared towards stepping that down and eventually getting these individuals into recovery. And if your basic needs aren't being met, then you're not going to benefit from some things. And so I think that was the first mindset switch for me of like, harm reduction does have a place, I think. We would like, if you're going to be using safe needles, I think a lot of people kind of say, oh, well, that's going to give them a permission to use. They're using anyway. It's not, nobody asks permission to go and intravenously use heroin. It's the same mindset when Narcan first came out. There was a lot of people concerned about it because it was like, well, aren't people just going to go get high now and hope they overdose and just have their Narcan on hand? And it's like, maybe, but like, hey, we still get to save their lives. So who are we to judge? So I definitely think it has its place. Have we fine-tuned that? I'm not sure. We certainly haven't here in Arkansas. I think it's very still kind of that you have your harm reduction side of the coin, and then you have your abstinence-based side of the coin. And it's getting those conversations and the people at the table to have a dialogue about how do we meet the patient where the patient is? And I'm a diabetic. My course of treatment is not the same as every diabetic that's out there. And everything that's working for me does not mean it's going to always work for every single person that gets a diabetic disease diagnosis. So that's kind of how I look at treatment too, is that everybody has different circumstances in their life and all those aspects of the Maslow's hierarchy of needs, if you're going to go through that. But so, I think we have a long way to go. And I think if people could provide a little bit more research and information to people about what harm reduction really means. I heard somebody say the other day, well, harm reduction's a lot like if somebody was suicidal, telling them to find a lower building to jump off of. And at first I was like, oh yeah, that makes sense. That's a great way to put it. And then as I started thinking through it again, it was kind of like, okay, I really need to do a little bit more research myself.
Yeah. No, I like that. That's a great answer. Thank you for that. Do you have a message for anyone who's listening to this podcast who is going through an addiction, Dory?
I think probably like the best gift you could give yourself is recovery. Like, you are worth it. People don't like the symptoms of this disease. It's not the person. And I think as soon as we can get somebody to understand that the things that you've done during active addiction or active use is not who you really are, and that person that had morals and values and all those things that people say you lose in addiction are still there. And so don't give up on yourself. Continue to seek treatment. Listen to your treatment providers. I think, this is not a buffet that you pick and choose which parts of recovery you really like. I mean, if you see somebody that's had long-term recovery, follow their direction and do what they're saying to do, and listen to your healthcare professionals because they really do know what you're doing. So probably just don't give up and you are worth it. So give it to yourself. Give yourself recovery.
I love that. Thank you for that. Last question. Can you tell our listeners how to best to contact you and to find your service online?
Yeah, sure. Our facility is actually, it's going to be the embarrassing part. I don't totally know my own phone number because we're changing it. But our website is www.naturalstaterecovery.com. And our phone number over there is 501-319-7074. And that is, you can always also, either one of those will reach out to either one of our facilities. And if it's trying to get in touch specifically with me, you can go through those numbers as well to reach out to me. I get it's weird when you change your name to CEO on LinkedIn, how many people reach out to you and try to sell you some stuff. So,
okay.
Yeah, lots of billing software. It's great. But so yes, I would just go to our website. On there, you can you can go in and fill out that form for us to contact you. You can call the number and get somebody specifically there as well.
Right. Well, thank you so much for your time today, Dory. I've really enjoyed hearing about your journey and the great work that you're already doing in 4 months. It's quite incredible. The level of care that you bring to your team is just very inspiring to hear. And I'm sure people who are listening to this podcast have certainly taken something away from it. So thank you very much for joining me today. It's been a real privilege and honor. Thank you.
Yeah, thank you for having me. I appreciate the opportunity.